were talking of in the morning was that when you're looking at building a robust, sustainable healthcare system, we need to start building efficiencies. And what we discussed in the morning was how do we start bringing more revenues, how do we control costs without compromising on the ethics of what the system is supposed to be and do. But an important aspect is having credibility among the patients. Now, when you're building credibility among the patients, we are using all kinds of media today, including social media. Now, having an omni-channel approach towards creating a patient outreach needs to be a good balance between what is it that you are speaking and how credible it is. So the panel that is here today is gathered where we have people from the doctors, we have people from alternate medicine, we have someone from the pharmaceutical sector, and the conversation is going to be around authenticity, ethics, credibility. So, Mr. Alok Khatri, let me begin with you. You know, you represent a pharma company and you've been dealing with the healthcare sector for a very, very long time. You're very entrenched in the healthcare system, doctors, etc. How have you seen the role of data analytics in creating an omni-channel marketing strategy that has worked to your advantage, which has worked towards not just creating a consumer experience, but also talking about ensuring patient safety?
So, Harvinder, I think it's a very nice question, first of all. And see, overall, first we have to look at that data is available for a long time. But nobody analyzes the data in the way it should be. And I think in the last 10 years, data analytics have become very critical overall in decision making. I'll give an example to you. Like somebody has diabetes where the sugar levels are fluctuating. And today you have got methodologies where live, I would say, whole day, 24-hour, you can actually, the patient can see how their blood sugar is behaving. And that helps to take a very clear decision that what you should eat at that time or what you should not eat at that time. Which food is actually leading to a spike in sugar levels in the body. Now, these are very simple things which are happening. But over a period of time, when we capture the data and you have a longitudinal analysis of that, you actually build the protocols, that which protocol will work in which type of patient. You have an obese patient who behaves differently. So there are patient segments. So in which segment, what should be the methodology, where nutrition and like diet alone, along with exercise, can take care with maybe a metformin, and where you need actually insulins. So it actually helps today with the analytics in so many ways. You know, it is one, to make the life of patient better, okay, to take decisions which are very live, and you don't have to really wait for HbA1c for last 3 months, okay. So I think the speed has also become quite good. You have got many medicines which have come, so there is a choice available for the physician also to really treat the patient appropriately. So that is one part. The second is, how do you capture the patient journey and understand the pain points and what you should do, especially at different part of the journey, to take care of those pain points. So that is another area where data analytics helps in a big way. So frankly, if I go on, there would be some hundreds of benefit. But these are some of the things which I felt I should share here.
No, absolutely, sir. Data is known to create personalized experience. Apart from personalized medicine, I think, patient experience itself is a great thing. And what we were talking in the morning is that, when you create perception, you also create expectation. and that builds the confidence of the patient.
Yeah.
Dr. Charudat Arora, you know, when we're talking of creating communication and reaching out to the patients, one of the basics of communication is to ensure consistency. And today, when we are, as a hospital, talking about communication, we are talking about the various touch points that exist. But how do you ensure, as a healthcare provider, that the messaging and the perception being created at every touch point has a consistency that we expect to create?
That's a very pertinent question, Harbinderji, and thank you so much, Business World, for having me here. You know, when it comes to communication to the patient, there are different endpoints and objective parameters which you have to look at. Awareness is definitely the key point where why you are communicating to the patient, why you're telling about X, Y, Z to the patient and the community, but how you are telling it actually makes a larger impact. Starting from the community itself and understanding every community from their own literacy level, their knowledge areas, their demographics, their socio-economic status, and etc. When you read, when you do research about that, only then you'll be able to give a very strong communicative factor regarding that particular problem. If you're talking about tobacco cancer, for example, you're talking about cancer in a community which doesn't even understand cancer, your entire purpose is defeated. Similarly, you understand the demographics, you know what is the main issue which is pertinent to that community, and then hit the bar over there. For me, as a healthcare provider and a wellness influencer, very important is understanding where to point the deadline, where to stop my information, because otherwise it gets boring, it gets vomiting, and it's of no use. So make sure you have a criteria set for your audience, make sure you have your community well planned, make sure that whenever you are dealing with them, you talk to them in their own medium, their own language, what they are really looking forward to, and only then hit the bar so that it makes the maximum impact.
Awesome. I think, you know, what caught my attention when you were speaking was the word community. You know, one of the missing things in the healthcare sector today is the trust and faith that we have in the system. And the first question that we ask ourselves when we go to get treatment or consult a doctor is to understand, are we in the right hands? During this era, with this particular challenge, I think what has worked really well is to build communities. Dimple, my question to you is, you've built a very successful community online, and it's on. So when you're building a community, what are some of the strategies that have worked for you to not only get a set of like-minded people together, but to also build faith on you in that community?
So I started building my health community in about 2020 when the pandemic hit, okay? So the clinic started in 2017. At that point in time, we were doing one-to-one consultation. We were helping patients overcome their chronic lifestyle diseases. That's what we specialize in. But the pandemic brought a new challenge and a massive opportunity. People were sitting in the comfort of their homes. They were captive audience in their own homes. All we had to do was take that complex education about healthcare, break it down into digestible small parts. So I challenged myself in 2021 that every day I'm going to record one video for 60 seconds, no matter what, no matter who's watching it, no matter who's consuming it or not consuming it. My idea is to put out that education there. The best marketing tool that you have in the healthcare industry is education. It's not advertising, it's not marketing, it's not below the line collateral, but it's education. When you educate your audience, you're empowering them to make the right decision to come to you. So if I have educated this particular community on how, you know, certain Ayurvedic rituals can help you prevent diseases, and they've already started practicing it. When they get sick, if and when, God forbid, they're not going to go to another Ayurvedic doctor. They will come to my team of doctors for a consultation. So building that faith and relationship is a long-term process. It is not overnight. The same audience I've been educating over the last 3 to 4 years, because I'm not expecting them to be sick every day. Over the last 3 to 4 years, education processes happen. And the minute somebody in their extended family gets sick, this person is suddenly a key opinion leader in the family saying, I know this method works. I suggest that you go to this particular clinic. So education has to be a daily process. It cannot be overnight. You can't like simply come with this guerrilla warfare kind of a marketing technique, which happened back in the day, you know, Philip Kotler days. We studied marketing and MBA, right? We had this guerrilla warfare, you know, like bombard them with information. Like he said, it's going to cause a nauseating effect. It's like diarrhea. You know, you're having a word diarrhea on your audience. Don't overwhelm them. Break it down into digestible parts. You know, badhazmi is another big problem that we face, right? So don't give indigestion to your own audience. Correct. Let them make the decision. Let them come to you. So that's a pull marketing versus push marketing. I'm not pushing information. I'm just making it available like a buffet. You choose what is suitable for you, and you come to me when you're ready for it.
You know, also very beautifully you have articulated, because what I understand is when you're creating a community, if there's a very clear, honest intent, when you said that, you know, I'm not bothered if somebody is consuming my content or not, I was still putting it across there. I think that's a basic fundamental, that when you're building a community, you do it with the right intent. Akshat, you know, I'm sorry, Deva, I'll pass on to Akshat right now, because this question is also pertinent to you. I mean, you know, you're an MBBS doctor and you also have a very strong community.
Yeah.
What has worked for you?
So I also started, like Dimple said, it was around COVID, but I was already into online consults. So it was a very different reason why I entered Instagram predominantly. So there was a lot of WhatsApp Gyan and lots of YouTube videos which had already started coming, have this kada, snort ginger, you know. So my family group, my friends and all, they started bothering me. कि ये करना है कि नहीं करना है, ये करना है कि नहीं करना है. तो I obviously most of the time said नहीं करना है, नहीं करना है, नहीं करना है. So then they got irritated and saying that if you think you know so much, why don't you do the same? Why don't you make authentic videos and put it out there? So initially, so obviously time nahi hai. But then like Dimple said, you need to take out the time. So I started taking out the time, but very honestly, my agenda was never one post per day or anything, because I'm a perfectionist. So agar, if I have a strategy in place कि मेरे को ये करना ही है, and if I don't do it, it really backfires. So I went with the flow. I said, हो गया तो हो गया, नहीं हुआ तो it's all right. So my indirect strategy was that I have to put it, but without that extra pressure on myself. Second thing was, I am breaking some myths over here. And my hope and expectation was, because I'm a doctor, people will believe me. That was my hope and expectation. Of course, kabhi hope theek tha, kabhi expectation nahi tha, but that's okay. Then third thing was, whatever response I get, whether someone is asking me something, whether I get a like or dislike or whatever, I need to respond to that person. So I think that mera jo tha ki even if it's one question, I want to answer that. So I realized that when I started answering questions, the trust started building up. Then one thing led to another, then more comments started coming, फिर DMs पे आने लग गए, तो वो एक following बनती गई, then that community kind of increased. Last but not the least, my thing, what I realized was fun. So I tend to dance, not here, just on the camera. So because of that fun aspect, people started, I mean, you can say in a way there was a little bit of more relatability, but that, okay, yaar, someone is talking about health, but in a lighter note. It's not very serious, he's not angry on the camera. So then that feedback started coming, thank you for making it easy. Thank you for making it fun. So then I realized that now when you ask me, retrospectively, if you ask me my strategy, don't have one, but have the intent. My intent was very clear, that I am doing this to clarify myths, help people get the right information. Now how you decide to deliver that information, you can choose.
What a method in the chaos. So sometimes if your intent is there, the strategy jot nahi padti, you do whatever. But I have the question for you, sir. I've seen your Instagram, and I've seen you dance. But today you did not.
That's what I said.
So
for the
your
camera.
friends have been telling you that, you know, you should demonstrate what you know. But I aapne kiya nahi, sir.
If I'm teaching, then I'll do it.
Yeah. So, nahi, bhai, sir. Intent ki baat kariye. Dr. Devakant, you're also pretty active on digital media, social media. You're also a doctor. And we know that, you know, patient feedback has always been extremely important in creating patient-centric approaches in everything that we do in the healthcare system. How do you integrate patient feedback into your marketing strategy so that you could even better the patient centricity in how you are being true to your profession?
So thank you, Business World, for this opportunity. So as you said, patient feedback is probably the cornerstone of what we do, and it is, personally for my organization, it's at the heart of what we do. And not just the marketing aspect of it, what we do is that we ensure that almost 30% of all our OPD patients and 100% of all our IPD patients get a feedback call. And as in the previous panel discussions, we would not just after the procedure or just in the OPD ask them that. It's usually after a month's gap, and a proper data is maintained. And for all the negative reviews or negative feedback that we get, we make it a point to reach out to them and solve the problem at that point. Similarly, we take the Google reviews very seriously, and across our hospitals, we have around 5 of them. And on all of these, their Google profiles, we don't have a single negative feedback. We did have negative feedbacks, but then we reached out to the patient, we solved the problem, and then we not literally made them, by our actions, force them to change their Google reviews. So it's very important. And when you come to marketing, the feedback that we get in the previous organization that I was working with before starting my own setup, so there was a lot of, I used to see, they also had a similar system, but most common feedback from the patients was, "Mujhe aur call mat karo." So that is one thing that I made sure that we will not overcall or overdo it. Just one feedback call, and if the patient is not picking up or something, we don't want our numbers to go into the spam zone. So not overdo it, but at least a system should be there. During the work hours, we have a floor manager in each hospital, like every one of us do, and we keep asking and taking care of the patients there itself. If there is a problem that needs to be addressed right there, we do it there and then.
Dr. Charudit Arora, how do you manage it? Patient feedback, patient experiences, because apart from your medical practice, you're also very passionate about the senior care. In fact, professionally also, you are now involved in it. So how are you managing it?
So, patient feedback is one of the most important parameters of a quality and of achievable healthcare system. And because my average patient base age is 66 years, for me, patient feedback is also very subjective because it comes not only from themselves, but also from their children, who are technically the decision makers of their home. So we have to kind of substantiate that what are they looking at, what are their achievable points, what are they looking at their parents' health, are they really understanding what do they need, and are we able to provide that? And then we take a patient feedback. We have a system in place wherein we have patient feedbacks where social workers, patient care coordinators, they visit patients' homes because we provide senior care at their own, at their own doorstep. So our patient care coordinators visit their homes and understand where are the lacuna, where are the lacks? Are the lacks mainly in the equipment modalities, in the infrastructure modalities, at their own home areas, internal areas, their key social issues between the family members, and so on and so forth. When it comes to dealing with their kids, who are the decision makers, who might not be physically living with them, but they might be, kind of keeping an eagle's eye or keeping a contact with our team every day, we try to have a very, very soft and, as I say, a very nice camaraderie, wherein they are also able to tell us that what are they facing, what are the issues that they are facing. Sometimes they are unable to explain that, my mom's issue is not because of her actual health, it's because nobody talks to her. So that kind of camaraderie needs to come out from your patient care coordinators. As the other, the panelists said, that it's not just about pushing the feedback calls and making them come to the spam, but it's very important to create a relationship. My only funda to entire of all my team members, including my patients' families, is you treat us like your family, we'll treat you like your family. Don't expect that we'll be continuously caring for you and there's no reciprocation from your end, thinking about, oh, the service is done, who are you, who am I? Then the relationship will not be formed. If you expect me to be your, holding your hand and taking you through this journey, it's very important to take my entire team as a part of your family, tell them honestly what are you facing, where are the lags, and then only we'll be able to take care. So my key points in patient feedback is a good time management, creating a camaraderie and a rapport, and understanding if you're dealing with the patient himself or herself, or with a key decision maker who can have a different attitude towards life.
Mr. Khetri, you're the only one on this panel whose target segment is not the patient directly. How do you manage this communication without stepping on the challenges of ethics? Because, first is for the audience, if you would want to define who your target audience is when it comes to marketing. Second is, how do you approach them so that you do it ethically? And how are you able to create an impact through communication to do the right thing, being in the pharma space?
Okay, it's a nice question. And so what we did actually, as far as we are concerned in pharma, we have to segment the doctors. So doctors become the primary, target or maybe target audience for the pharma company. Because for us, the medicines are prescribed by the doctor for the patient. So patient is a consumer, and doctor becomes like a customer. The doctors are of different types. So if I look at one disease, for example, so suppose if we are treating prostate cancer, so somebody would have a preference of X type of treatment, somebody will have a preference for Y type of treatment, and somebody will have a preference for Z type of treatment. So the targeting or segmentation is done, and communication is done according to the segment of the doctors. So today, when we have moved to e-detailing, maybe around 20 years back, from visual aid to e-detailing, there automatically, when the pharma rep or specialist goes to meet the doctor, the type or the segment, once you press, you get the right type of communication. And these are all ratified by the medical team, because we have very strong regulatory department as well, and we have to really take care of those regulatory issues. So there's no claim which can be done which is like unwarranted. Okay? So it becomes a real problem in that company, and people can lose their jobs if they have not done their job properly. The second is, we have to also look at the segmentation of the doctors from the attitude point of view. Like some doctors, they're more focused on the patient. We call them V doctors. Or somebody would be an eye doctor, somebody may be a IT doctor, So that becomes another segment, which is known as attitudinal segmentation. There can be another one where we actually look at what is the style of doctor. Now you say, somebody is directing style, somebody is expressive style. Now those people who have a need to control over self and control over others, they are known as like directing style. And where both the controls are lower, that becomes an affiliative style. So different style of people, they require a different communication, which means a directing style person, you have to be asking a clear-cut question, yes or no. But for an affiliative style doctor, you will ask very clearly a visualizing question. And a thinking style doctors, you may ask an open-ended question. So thinking style doctor is somebody who has a good control over self, but who wants to control, who does not want to control others, but has a very good control over self. So that is one segmentation we do. So why we do all this, we actually try to customize the communication from disease perspective, attitude perspective, and the style perspective. So I think that holistically tells us that we are going in the right way for a particular doctor, which appeals to him. And ethically, all these communications are validated by the medical team.
Sir, I have a follow-up question. It's something that just came to my mind. When we're looking at the healthcare industry, the first thing that comes to our mind is a doctor. Everything else comes later. And the doctor has always been promoting the practice based on something that they claim to be word of mouth. Now, the word of mouth has always had extension towards getting testimonials, right? How important, and now we have influencer marketing that has come and taken over. How important is influencer marketing and influencer-based approach working for pharma sector so that the doctors feel not compelled by the pharma company, but compelled by the outcomes that are being created for the medicines.
Okay. So influencers are always very important, but they are products which are completely prescription products. There the influencer can be a thought leader amongst doctor. Okay. And suppose you have a consumer product or a OTC type of product. Actually the influencer can be anybody. You know, a person who is a satisfied customer or satisfied patient can talk about it. A celebrity, generally many companies are now using even celebrities to talk about a particular product, which are like a OTC product. So I think it depends on the nature of the product. But influencer, as I said, whether it's a thought leader or it's a celebrity or it's a common person who is a user, it all depends on the type of the product. So like we have got a product by the name of Lactair. It is for breastfeeding. Now there are many people who have got issues with breastfeeding. Now it's a Shatavari basically, you know, Ayurveda product and with other herbs. So it actually helps, and many people are not even aware about the issues which are related. So we work with Foxy, which is the largest gynae society, having around 45,000 doctors, and we have a program, Rishta, which we are doing across the length and breadth of the country, okay, just to really propagate this part. And like we have got another product which is NTID, which is for Rh negative mothers. Now what happens is, when this is the only product in the world, the people who are Rh negative, especially women, they have a lot of problems in conceiving and also the issues of miscarriage, etc. Now the only product in the world which we have in a recombinant form, okay, which is an immunoglobulin. Now this is one which saves the life of this patient and child. So now here, what we are doing, we are actually having Foxy talk about it through a RH Max masterclass. We also have, for example, trying to really see that any doctor in their social media can talk about that if somebody is Rh negative group and planning a pregnancy, they should basically contact them because there's an issue. So this is how we actually manage it.
Awesome, awesome. Dimple, you know, when we began the conversation, and in my last question that I asked you, we realized that, you know, what you were doing was an outcome of an intent that you had of spreading awareness, creating a community, building trust, building credibility. But at the end of the day, we need to measure the impact that we are creating, you know. So how is it that you measure the impact that you are creating, not only within the community, but through the community for yourself, that keeps you motivated, keeps you inspired all the time?
That's a challenge by itself, you know, to keep yourself motivated on a daily basis. You still have to wake up in the morning and remind yourself why you exist. You know, that's your ikigai. What's your purpose in life? So during the pandemic, my intention was to put the power back in the hands of the people, because preventive healthcare precedes curative healthcare, okay? We all agree to that. Both Western medicine and Eastern sciences believe that it is better to prevent a disease rather than waiting to get sick and then go looking for a cure, right? Are we saving lives by postponing death, or are we saving lives by improving the quality of their health today so they can live a better quality life for their loved ones? That's exactly the intention, you know, because my family suffered a lot with premature deaths. We lost multiple uncles and grandmother, and my dad was also having a near-to-death experience, and that had a cascading negative effect on all of us. The way I measure success is the amount of gratitude I receive back from my students and patients. It's not the amount of money that we make every day. Money is probably the secondary thing. That's why I quit investment banking to get into preventive healthcare, right? So money has never been a criteria or a measure of success, at least in this industry for me. And I respect all the doctors who've actually gone into this industry with the intention of saving and serving humanity, which is far above our professions, right? The measure that we have is, of course, you know, Facebook, Instagram, LinkedIn, YouTube, Snapchat, TikTok. You know, I have a very enthusiastic young team of interns, almost like 22, 25-member team, and they've self-populated themselves, wanting to be part of this industry where they get to interact with the end consumer, and they get to transfer those messages from them back to me. And in the process, you're feeling, you know, they're fulfilling themselves and feeling enriched. So we measure it in terms of comments, feedback that we receive on all of these social media platforms. And we've also tied up with NAS Academy, Nusair. So the app where we educate audiences through the 7-day challenge, 3-day challenges on a daily basis when they complete a challenge. Something as simple as today you have to wake up at 5 o'clock. Tomorrow you have to have 200 ml of warm water as soon as you wake up. Once you finish the challenge, you have to write your feedback, not just to report to us, but to motivate the rest of the community. So we're making our audience key opinion leaders in their circle of friends and family. That's the way I measure success. Are we having a ripple effect back in the society?
You know, I think it's very beautiful because apart from the good work that you do, you're also able to create an accountability within the systems so that you are following what you're expected to as a part of the community. My last question to the doctors who are also, having a strong digital presence, Dr. Charudat and Dr. Akshat, and Dr. Diva, is that how do you balance your time as a medical practitioner versus the time that you spend on social media?
Okay, so I'll just keep it.
The social media is not with a negative connotation, by the way.
Absolutely, yeah. So I'll be keeping it with 3 points, which is very important. One is time management and create discipline. I make sure that I wake up at the same time, I do my entire routine, give good amount of time to my clinical practice, and have my team dedicated for shooting my videos as a everyday schedule. So that is number 1 is time management. Second is delegation. I have an amazing social media team to myself who takes care of this, so I don't have to worry about who's doing what and how is it going and who's editing it. So delegation is very important. Having the right person, the right angle, everything is their headache, and I'm blessed with that. And the third is keeping yourself stress-free. If you have a good family, if you're blessed with good parents, if you don't have to worry about that shit of life, I think you will be very, very, very sorted in managing everything. So, so these 3 points, good time management, dedication, and have the luxury of life.
Thank you.
I think it's all about prioritization and delegation, everything what he just said. Just one thing apart from this, that I think all of us, all physicians, all doctors should devote some time to content creation, because maybe your posts, your videos might not go viral, but the patient, once he comes into your clinic, does go back and searches, and then he can find your content, which becomes very relevant. So keep doing it.
I think it's exhausting. Honestly speaking, I think it's exhausting, and you will realize that the more followers you get, there's a chance that you're going to have a lot of questions coming in. So what I do believe is, yes, time management definitely helps. Prioritization is key for me, because I also have a lot of online challenges which are going on. So I literally am choosing between my programs, my consults, my challenges, and my social media. So it's like everybody says, don't look at the phone first thing in the morning. I don't believe in that at all. Because if I don't look at the phone, I am just stressed. So I have few rules for me. I have app locks. I literally, I know that on Insta, I do not spend more than an hour, which includes posting time, not the recording time, of course. But there are times where you get, sometimes even on Insta, you get urgent requests, urgent questions. So yes, so you do kind of skip some of your other work and you kind of prioritize this. So learning to prioritize who to answer, because it's not that, and I mean, that's what's important, right? I allow myself to not answer. It's okay to not answer, because you get an idea of who's posting what, who's asked you what, so it's okay to say, this can wait till tomorrow. So if you allow yourself to do that, then it's easy to prioritize and it's easy to manage your lifestyle, which is again priority for me.
Thank you. You know what, Dr. Charudat Arora, you brought up the time management aspect of it, which was validated also by Dr. Chadha, but and I have a screen which says time's up, so I have to respect that. But we've been talking about empathy every time we're in a healthcare conference. And, but I think, what has come up today, which has added to this word empathy, is the intent and accountability. That's been the outcome of this particular conversation, and I really thank all of you for doing a great job. It's really tough when you have a backlash when somebody in a serious profession takes on to social media, but to do the right thing, do the the good thing, despite all that, takes a lot of courage. So thank you so much, all of you, for being on this panel, for taking out time to be with us. Thank you.